Hi, Brittany.
Hi.
I'm the nurse for room 1. I'm ready for a handoff report whenever you're ready. Finish washing your hands.
All right, sounds good. I'll meet you in there. Getting between my fingers and cleaning them underneath my nails for 30 seconds. Rinsing my hands, no splashing.
Hi, Kirsten. I'm Brittany. Okay. Knock, knock. Hi, Shelby. Hi. This is Brittany. She's going to be your nurse.
Okay.
Taking over. I'm leaving for the day.
Alrighty.
So this is Shelby Tripp. She's a 26-year-old female. She came to the emergency department 3 hours ago complaining of shortness of breath, dyspnea on exertion, chills, fatigue, fever, and pain. She has no known drug allergies. She's a full code. She is concerned she may have pneumonia because she's a nanny to a young boy who was recently diagnosed with pneumonia. She has a history of environmental allergies. She's a nanny, college student, and this is her first hospitalization, so she's a little anxious. She's alert and oriented ×3. Her temp was 102.3. I just gave her Motrin. She does have an order for Motrin, 400 milligrams every 6 hours, PRN for fever and mild pain. Her respiratory rate's 24, pain 5 out of 10, pulse 101, blood pressure 98/64. She's 97% on 2 liters of oxygen. She has a 20 gauge IV in the right forearm. The line is patent, non-tender, no signs of infiltration or phlebitis. She has normal saline running, 125 an hour continuously. There is some wheezing on auscultation and crackles heard in the bases. She has symmetrical expansion of the chest wall. Radial and pedal pulse is strong and equal bilaterally. No murmurs heard on auscultation. She does complain she feels tired and has all-around body pain and weakness. So recommendations, she does need some education on the proper use of the spirometer. Assess vitals. She is due for an albuterol treatment and good education on that as well. She just came back from her chest x-ray. She is positive for pneumonia, and she does have an order for an IV piggyback for piperacillin tazobactam, which is coming premixed from the pharmacy, and she will need to be started on that as well.
Okay.
Any other questions?
Nope, that's it.
Okay. All right, Shelby, it was nice meeting you.
All right, bye, thank you.
You're welcome.
Hi, Shelby, how are you feeling?
I'm feeling okay.
Okay, I'm just gonna prop you up a little bit, just because you're having like that trouble breathing.
Okay.
It's just better off if you sit up.
Okay. Yeah, that is better.
Alright, excellent. So just to make sure you're on 2 liters. So what is your pain level right now?
Right now, probably about like a 5.
Excellent. Making sure that everything's labeled. It's labeled for today, so it's all set for med administration. Alright, perfect. So I'm gonna go ahead and take your vitals, okay?
Okay.
I'll take your temp first. It's gonna be 99. It's gotten a little better from the motion. I'm gonna take your pulse ox. And she's 97. Okay. And then we'll take blood pressure. So blood pressure is 100 over 64. Alright, excellent. So I'm gonna take a look, peek, listen to your lungs, okay? Could you lean forward for me? Same. Okay, can you open your mouth breathing and take deep breaths. Excellent. If you can just lean forwards, I'm just gonna get the girth and take a deep breath in. Alright, I have bilaterals. So I did hear a little bit of crackling in there. Do you still feel like you're really shortness of breath?
A little.
Okay. I'm just gonna listen to your heart. Okay, cardiac sounds good, nice and strong. I was also counting her respirations, which were 20, and then I'm gonna just double check her pulses, make sure they're strong and bilateral. Thank you for crossing. It'll be over here.
Mm-hmm. Sorry.
Okay. All right, excellent. So I'm gonna go ahead and get the albuterol for you. Have you ever used albuterol before?
No, I haven't.
Okay. So what it's gonna do, it's gonna open up your lungs so you can get more oxygen.
Mm-hmm.
So I'm gonna get it for you really quick. So this is the mask for it. It's gonna go over your face.
Mm-hmm.
You're gonna breathe normally into it
Mm-hmm.
and just take in that medicine. It's gonna run for about like 10 to 15 minutes. A normal sign of albuterol is, you might feel like you're getting like palpitations, like your heart's racing. That's kind of a side effect already that comes with this.
Mm-hmm.
Do you have any questions? Any other questions about this?
No.
No? Okay, so if you feel like itching or you feel like your mouth is starting to tingle, your tongue is like starting to swell,
Mm-hmm.
just let me know, okay?
And I'll just know when it's done by.
So it'll stop steaming when it's done.
Okay, so like the medicine will be all gone.
Exactly.
Okay.
Okay. So I'm gonna start it, and I just want to verify your name and date of birth.
Mm-hmm.
And can you let me know if you have any allergies?
Yep. No, I don't have any allergies.
Okay, I'm sorry. Can you voice your
Yes.
name?
Yep. Shelby Trip, 22392.
Okay, and I just made sure this is the right dose, right route. So I'm gonna take your nasal cannula.
Mm-hmm.
And then pour it into the chair. Start this first so it doesn't blow in your face.
Mm-hmm.
I'm gonna put this all the way up. So nice and flat circle. Okay, so I'll be back in about 10 to 15 minutes, okay, to check up on how you're doing.
Okay.
Do you need anything else?
Yeah, I think I'm good.
Alright. Home hand hygiene. Hi, Renee. How are you doing today?
I'm good. How are you?
Good. So I actually need to go and help my other patient right now. But my patient Shelby, she needs antibiotics. Administered. Do you mind starting her piggyback IV for me?
Sure.
Alright, so just a little bit about her. She's a full code. She was, her admission was in regards to pneumonia.
Okay.
She had a little bit of a fever, but it's gone down now. And then the doctor checked out her chest X-ray far so he wants to get the antibiotic started.
Okay.
Alright.
What is the antibiotic? Is it the paper stone?
Yeah, exactly.
Okay. Sure. I could do that. Alright, okay, I have performed hand hygiene, and I'm gonna run to the Pyxis and grab everything I need. Hi Shelby, how are you? Good, my name's Renee. I'm gonna be your secondary nurse today. I'm helping out Brittany.
Okay.
So I hear you come in for some pneumonia. Yeah. Well, your cultures came back and the doctor has put you on the piperacillin, which is the antibiotic for the pneumonia. And I'm gonna run it through your IV. Do you have any known allergies?
No, I do not.
No known allergies. And can you just state your name and date of birth for me?
Yep, 2/23/92 in Shelby Tripp.
Thank you. So you should be getting this antibiotic a couple of times a day, so through the IV. You won't be going home on this.
Okay.
So the first thing I'm going to do Can I just take a look at your IV site, please? No redness, no swelling, no cooling, no warmthness. And it looks like your IV is running normal saline at 125 mils an hour. Everything looks good. Everything's labeled. All right. My medication, Shelby Tripp. Can you please repeat your name and date of birth?
Yep, Shelby Tripp, 2/23/92.
Any known allergies?
No.
No known allergies. And this med already comes pre-mixed from the pharmacy. Scrubbing my hoods. I'm going to get my backpack. Yeah. Running a secondary line. 4.5 grams at 100 mLs an hour. 50 ml bag. It is infusing. Shelby, if you have any symptoms such as diarrhea or bloody stools, I need you to let us know right away because that could be a sign of a super infection.
Yeah.
Vaginal itching, vaginal discharge, things like that. You just want to let us know. Also blood in your urine, and a decreased urine output. So
Okay.
just let us know if you notice any of those symptoms, and you know, we would have to take another route, such as finding you another prescription.
Okay.
Do you have any questions?
I don't. I think I'm all set.
You're all set?
Yeah.
Okay, let me just take a look at your IV site one more time.
Yeah.
Everything looks great. Okay, you have a great day.
Thank you.
Oh, some kind of headache. Ready to run?
Knock, knock.
Oh,
You all set? Are you okay? Yeah. Knock, knock. Hey, Shelby, how you feeling?
I'm feeling good.
Good. It looks like that albuterol's done. Are you feeling fun? Any like symptoms? Like, do you feel funny or anything like that?
Yeah, I feel good. I feel a little bit clear, maybe.
All right. Stop for you.
Yeah.
Oops. Without taking your glasses. That would go to the oxygen back on.
Alright.
Put it back on your 2 liters. Alright, so I'm just gonna take a listen to your lungs again to see how that albuterol helped you out. Do you feel like you're breathing a little better?
Yeah, I feel a little
Yeah?
better.
Okay,
Mhm.
perfect. Take that with your mouth open for me. Alright, perfect. So you're not wheezing as much as you were before. I'm actually gonna take your pulse ox too. And your pulse. Okay, so you're at 98 for oxygen and at 120, which is a little higher than you were before, but that's normal, okay? But you don't feel any like tingling or anything like that. All right, so this is gonna be a perfect time for us to talk about the incentive spirometer. Have you ever utilized one of these before?
No.
Okay, so pretty much what we want to do is we want to measure how much air your lungs are able to take in,
Mm-hmm.
and so this will pretty much be our baseline as to whether or not you get better or worse.
Mm-hmm.
So you're gonna take a deep breath in and then take it out, and then you're gonna put your mouth and take a nice suck in, hold it for 3 seconds, and then blow it out. Okay, and then that's when so you can go ahead and try it. Take a breath, hold it for 3 seconds, and then let it out. Perfect. All right, excellent. Okay, all right. Do you need anything else? Do you have any other concerns? Maybe I can answer for you.
How often do I have to use that thing?
So you want to use it every hour.
Okay.
You do want to use it like 10 times, like pretty much when you're awake. So what I like to tell patients is when you're watching TV, like every time a commercial comes on, you want to like try and use that. It's really good. Anything else?
I think I'm good.
All right, excellent. So I'll go ahead and check back with you in a little bit. Here is your button if you need anything right next to the bed.
Mhm.
You're lowered all the way to the ground so you don't fall, and you're all set, okay?
Thank you.
All right, perfect.